Clinical judgment. This is the fourth principle in the voice framework, and it begins with a familiar nursing question. Are we treating the problem we can see or the system that keeps creating it? Imagine a patient is ready to leave the hospital, but the medications are not ready. Transportation has not been arranged. The family is confused, and the discharge is delayed for hours. The easiest response is to ask who failed to complete the discharge. But that question may send us towards blame before we understand what actually happened. The nurse sees that planning started late. The team did not share the same plan. Community services were limited, and no one clearly owned the next step. The delay is visible. The system conditions underneath it are not. And that is the distinction at the center of clinical judgment. The symptom tells us what happened. Clinical judgment asks why it keeps happening. It moves nursing from reacting to the delay to diagnosing the system that produced it. This is the same thinking nurses already use in patient care. Assess the situation, recognize the pattern, identify the risk, choose the right response, and evaluate what happens next. Clinical judgment in advocacy applies that thinking to systems, policy, technology, education, and operations. In this example, the answer is not simply to remind staff to discharge patients faster. The team may need earlier planning, clearer accountability, better handoffs, or stronger community coordination. The goal is not to push people harder, it is to redesign the process. And nurses also ask what happens if the system does not change. Longer stays, delayed admissions, frustrated patients, higher cost, and a greater risk of readmission. Clinical judgment connects today's delays to tomorrow's consequences. So when a problem keeps returning, ask what are we seeing? Why does it keep happening? What system condition is creating it? What action addresses the cause? And how will we know the change worked? Clinical judgment is more than noticing that something went wrong. It is understanding why the problem continues and what must change to prevent it from happening again. Observation reveals the symptom. Clinical judgment finds the system cause. That is clinical judgment.